everybody. Welcome. We'll give everyone a little bit of time here to get connected to audio. Apologies for the technical difficulties, but hey, we're OTs and we are flexible, and thank you all for adapting. So if you hear from other friends or coworkers who are trying to get in, send them the updated link. That would be helpful, but thank you so much for joining us. All right, looks like the waiting room's slowing down, so we'll get started. All right, so officially welcome to the third annual Alumni Speaker Series. We are just thrilled to have the opportunity to bring everybody together tonight and to record this, to be able to make it available to our students and faculty asynchronously as well for those who had other commitments tonight. I'm Julie Dorsey, the chair of the department, also a super proud alum of our program. And those who have come to these before have heard my spiel. I'm going to do it quickly because we lost a little bit of time with our technical issues, but it's just such a great honor to be able to bring this series to our students and to our alums so we can all learn with each other, from each other, and to spotlight the work that our incredible alumni are doing. I've lost track of the total number and I need to recount it. I will for the next month, but we have had, I don't even know, probably close to 30 alumni now that we've spotlighted. And it's really just remarkable to hear the work that they're doing and for them to be so dedicated to give their time to our current students to share, their innovation, their passions, where life has taken them beyond ICOT, and again, to help to bring some content to you that maybe isn't in the curriculum, should be in the curriculum, is more advanced topics, advanced practice or innovative practice, and kind of everything in between. So, with shared vision with Emma and Julia, who are now grad students, they were juniors when this idea sort of came about, and with my other amazing co-facilitator, Jenna Heffron, and sort of the four of us with a lot of cheerleading, a lot of supporters along the way, have brought this shared vision, again, of deepening alumni connections, getting important content to our students, helping our students and alums network, having our faculty in the same community and space as our students and alums at the same time. And it's just such a powerful way for us all to get to connect and learn and grow as professionals. So without further ado, I'm going to turn over to Emma, who is going to share some accessibility features, and then she'll introduce our speaker for tonight. So Emma, I turn it over to you.
Yeah, hi everyone. Thank you so much for being here. We are so excited to be back for our third year, and we couldn't think of a better way to start it than with Amber and the absolutely amazing presentation we're about to have. But before we get started, I want to give some quick access info. So for the live transcript, if you click on CC live transcript at the bottom of your Zoom window next to reactions, two options will pop up. The first is show subtitle, and that will make captioning appear at the bottom of your screen. And to turn off those captions, just click on CC live transcript again and then hide subtitle. You can also click on view full transcript, which will make that live transcript appear on the side of your Zoom window. And if you want to have the full transcript and the chat feature open at the same time, go to the top of the live transcript window and click on the downward facing caret, aka Karen. It's been too long since I've gotten to say that. And then pop out, and you can move that live transcript anywhere on your screen. The chat is also at the bottom of the Zoom window next to the participants button, and similar to the transcript, if you click on the chat button and then the caret at the top of the window, you can choose to pop that out and move the chat all around your screen. So you are more than welcome to use the chat feature throughout the presentation, during the Q&A. You can ask questions through video, audio, chat, whatever way using the technology feels best for you. Like Julie mentioned, the session is going to be recorded along with an edited full transcript, and we'll post that to the virtual OT Canvas site for current students, faculty, and staff to access. If you're an alum or another community member on the call and you do want access to this, just let us know and we'll find a way to get it to you. But like we said, tonight is our first speaker series event of the semester, and we have the pleasure of hearing from Amber Edwards. Amber graduated from IC in earning her bachelor's in 2018 and her master's in 2019. 2014. Currently, she's a travel OT in New York City, working with the geriatric population and skilled nursing facilities. And in addition to being an OT, Amber is also passionate about fitness. During her time at IC, she was a 2 times All-American hurdler and captain on the women's track and field team, and currently enjoys strength training with kettlebells as a certified Russian kettlebell coach and dynamic sports performance certified coach. Ooh, sorry, a lot of big words there. Amber is also a podcaster. She created her own podcast in 2020 called Reaching Your Potential, OT and Potential. The initial mission of the podcast was to present her individual experiences as a new grad OT, but has transitioned now to empower and highlight other people of color in OT and beyond. Overall, the vision of her podcast is to engage and inspire all OTs and others to reach their fullest potential in life. Her session tonight will discuss the importance of creating a sense of community and empowering minorities in occupational therapy and beyond. So Amber's going to start us off with an overview of her work and all of her experiences. And then after that, we'll have a question and answer period where you can chat directly with her. So if you have any questions or anything at any point, please feel free to ask. And without further ado, I'll turn it over to you, Amber. Thank you again for being here.
Good evening, everyone. Thank you, Emma, for the introduction. Thank you to the OT department for inviting me here tonight. It's definitely an honor just being, a graduate of the occupational therapy program at IC, but just even being an alum and providing some insight, and hopefully you guys learn a thing or two. And if you have any questions, even after the presentation, feel free to put it in the chat. Emma kind of explained all that, so I'm not gonna prolong that, but I'm gonna share my screen so we can get started. Give me 1 second. Okay. I'll have to get back. Oh, okay. Okay, perfect. Everyone see the screen? Perfect. Okay, so the topic for tonight is the missing piece to OT, increasing racial diversity. I'll talk a little bit in terms of the research that I did while I was at IC. Shout outs to Dr. Carol Dennis for being a huge advocate for that topic, not specifically racial diverse, but we were talking diversity as a whole. But I'll talk a little bit more about that in the next couple of slides. So this is kind of the agenda for tonight in terms of what we're going to discuss. The first thing is me not really being your average OT in terms of like the different passions or meaningful occupations I do participate in outside of OT. We're also going to talk a little bit about the AOTA vision that AOTA actually announced in 2016, what they want to see the profession hopefully in 2025. Then what does reaching your potential really means, and then some OT thoughts and insights. So not your average OT, I did enter Ithaca College, actually not as an occupational therapy major. I transferred into the program my sophomore year from the health professionals pre-professional program, and I wasn't really sure exactly what I wanted to do, but I knew I wanted to help people. I wanted to be in a health profession, and I started to kind of do a little bit more research in terms of therapy or rehab occupations, and physical therapy of course came up, and then also occupational therapy. So I actually did not know what occupational therapy was until my sophomore year of college. Never heard of it in high school, never heard it when I was younger. So it was just an interesting profession that I wanted to explore a little bit more. So I did transfer into the program and I got in, and I'm so glad I made that decision. So I graduated in 2018 and 2019, my bachelor's and master's. And my other meaningful occupations, as Emma mentioned before in the introduction, was fitness and podcasting, because I still participate in that on a daily basis. So ALTA in 2016, they gave out this announcement about a vision that they have for 2025, and it was geared towards diversity and inclusion. And this is what they said. They said, as an inclusive profession, occupational therapy maximizes health, well-being, and quality of life for all people, populations, and communities through effective solutions that facilitate participation in everyday living. And of course, that is a great statement that AOTA did bring forth, but we also have to dive deeper and kind of ask that question, what does inclusive really mean? What does that really look like? Does it mean in terms of diversity, in terms of gender, race, sexuality, things of that nature? Inclusive is such a general term that a lot of people do use, but we also have to think a little bit deeper as to what that really looks like as us as a profession that is serving a diverse population. So this is kind of what Reaching Potential kind of comes out. I just started in September of 2020, and it was actually during the time when I was in my MBCOT journey. I graduated in 2019, and I was expecting to pass my first time the MBCOT, but I actually didn't. It didn't take me 2 times or 3 times. I passed after my 4th attempt. And it was something that I was struggling with because I knew that I had the knowledge to pass the boards, but I was just struggling in terms of strategies or something. But I'm so glad that I did go through that journey because I have a deeper passion for OT because of the journey that I faced. So while I was actually about to pass or take my boards, I told myself that whenever I pass this board exam, I want to tell my story and kind of be a resource for those who may not feel confident to tell their story, because a lot of people may struggle with this exam but never publicize it or tell other people about it. So I wanted to be a resource initially for OT topics that may be on the exam, and even showcasing my experiences as a new grad OT, such as going through interviews, going through the interview process for a job, or my first OT job, my first discharge, or even facing death with my first patient that I've been working with. All these different experiences that I feel like a lot of podcasters who are in OT don't really talk about. And these are just like transparent and honest conversations that I've had, not just like with myself, but with other professionals as well. So as I started to kind of get good feedback on the solo episodes I've had, I started bringing out some other health professionals that I met through social media and through the Black OT community that had interesting stories that I knew that a lot of people would resonate with and also relate, or may not have any idea of what we go through as a Black clinicians, whether OT, PT, nursing, teachers, things of that nature. So I really wanted this podcast to really highlight not just people of color, but just like all of us in general, that we all can reach our fullest potential in like everything that we do. So in the next couple of slides, we're gonna kind of have some discussions. You can either write in the chat or you can take yourself off mute and to answer certain questions, because I'm going to highlight a couple of episodes that I've had in the previous seasons that I've had on my podcast that really resonated with me. And I felt like it will help highlight and give people insight in terms of the Black OT experience or clinician experience, and maybe some things that you may not have thought of as a clinician, or maybe when you become a clinician in the future. So the first topic is self-care tasks. We all talked about this in terms of ADLs. Self-care tasks is a huge part of a person's everyday life, not necessarily just washing your face and like taking a shower, but also doing your hair. And for me, hair care is a huge occupation for me, and also for a lot of my clients or my patients in the SNFs and in any setting that I have worked in or work with. And it definitely does look different in terms of when you're looking at a specific race or ethnicity or culture based on the hair types. And for me, I remember like in college, I used to change my hair all the time, but now I locked my hair, so I don't really change my hair as much. But it's just interesting to see that certain discussions with hair care will look different when you are looking at a patient that may have straight hair that can be easily managed with like shampoo or conditioner. But then when somebody has coily hair or more coarse hair, the routine is going to look totally different, or the duration of how long it takes will look totally different. So before I even go into the video, does anybody have any answers or suggestions in terms of like what are some skills that are required to engage in health and hair care tasks? So if we can think about like bilateral coordination, reaching behind your head, yes. Upper extremity mobility and strength, sequencing, yes, for sure. Even some type of dexterity as well, depending on what type of style that's being done, in terms of like braiding, like French braids or braiding hair, cognition for sequencing. So like these are just some examples in terms of it takes a lot of skills, endurance for sure, depending on how long it takes you to do your hair, grasp and pinch, grip, yeah. Good, yeah, these are great. And it just proprioception, exactly knowing your body is in space, where the hair is in your head. So many skills, right? Like, so it just comes to the fact that hair care is a complex ADL. So this little snippet on this episode, we were actually talking about the topic of ideational apraxia. And this is usually known for anyone that has some type of cognitive deficit where they're using a tool in an inappropriate way. And we actually had this discussion about that term and what it looks like to the average person in OT, thinking about a non-cognitive person, but now like thinking it in a Black hair perspective.
Is using a toothbrush to brush their hair. And then it was like, what diagnosis or disability do they have, right? And they gave multiple items, but one of them was ideational apraxia. Mm-hmm. So obviously, what
y'all don't get that, like Black people can use toothbrushes to lay out their edges, like you get that nice little.
I brought my,
like you have to lay those edges out sometimes, and you get one of those old toothbrushes you don't use anymore, and it easily lays it down with no problem. And of course, they don't take that to account that like it can be used for other things, but it doesn't have to equate to that diagnosis.
Exactly.
So we kind of had that discussion because in the beginning, when you think about that term, yes, of course, like you're going to think about a cognitive person, a person that has these cognitive deficits, but then we have to think of the person in a holistic way, right? We have to think about the person's routine or the culture in that person, that in the Black community, using a toothbrush to lay out someone's edges is going to look normal. So maybe you may have an older adult that may be doing that, or just a regular adult or person using a toothbrush to lay out their edges doesn't necessarily mean that they're using it in an appropriate way. That can be just like the culture or the norm for that specific person.
Person is using a toothbrush to brush their hair. What person?
Okay. Okay. So the next episode, this is with one of my Black male OTs friends, and we were talking about occupational justice. I feel like we talked about maybe very, not a long discussion in school about occupational justice, but some people can write in the chat, what do they believe occupational justice means? It can be occupational justice or even occupational injustice as well. Right, social isolation, occupational deprivation. And so as people continue to type in the chat about what occupational justice means to them or injustice, is the benefits, privilege, and harms associated with the participation in occupations and the effects related to access or denial of opportunities to participate in those occupations. So it really, people are able to do what they want to do when they want to do it, right? And when you think about justice as well, you think about equality, you think about equity, you think about these, that the person is able to participate in these occupations regardless of what environment that they're in. Access to occupational participation, right? The right of opportunity for everyone to participate in occupations. The injustice is not being able to access the occupations meaningful to the person in the way that they want to engage in those occupations, right? So we all have that idea that is to have access to participate in these meaningful occupations, and injustice is just the opposite. When the environment or something is denying this person to participate in whatever occupation or meaningful task that they want to participate in. So in this episode, I was talking to one of my OT friends here. He actually has a business where he creates t-shirts that has occupational justice on them, just to advocate for people to look it up. What does occupational justice do mean? And we just kind of had like a deeper discussion on what even occupational injustice looks like.
I just kind of wanted to put it on a shirt, for one, so I can advocate and wear it in my videos, especially for the TED Talks for OT series, because I wanted more people to just look it up. If I can just inspire them to Google it and learn more about it, I figured that that was the first step. And then once I started wearing it, I said that people would probably wear this. So I just started selling it. And now I have people as walking billboards to wear these occupational justice.
Delis that don't really serve the healthiest snacks. That's occupational injustice. Like how are you supposed to meet that goal of, oh, well, you need to eat healthy. Well, how am I supposed to get food if there's no market near me? You know, it's
Exactly.
like you have to think about all these different things. And I love how just one shirt can be a walking billboard for that.
So now we're gonna dive into another topic. Since we are talking about justice, we're going to talk about racism and just like assumptions and stereotypes and things of that nature. And you may not see this on a daily basis. I know for definitely, I'm blessed that I haven't experienced this yet in a personal way, but I have had friends who are Black practitioners who have experienced racism in the workplace. And it's not necessarily from their coworkers, but it's also from patients. And it's very difficult to go about that situation when you are the clinician, you're the one that has to be professional, and the patient may call you out your name or may say a racist slur or something that is definitely inappropriate. And you have to figure out what's the best way to deal with that. So I will let this video run. This is actually a Black PT out of upstate New York, and he was talking about a situation where he dealt with racism in the workplace.
And like as he was flipping the desk, and when I said, all right, I'm gonna give you some time, I'm gonna walk away, I'll be back when you're ready. And then as I was leaving, he said, no, I'm not, N-word. And then I come back, and maybe I should have kept walking, but it was just like a sting.
Even though we're letting it go, that's the professional route, but we're also human beings. I
Yeah.
don't think that we deserve to be disrespected in any type of way, especially when it comes to racial slurs or just derogatory words that were called, like we were called that back in the day, like a long time ago, but there are people still in 2021 that are still using that word on people that look like you and I.
So it's like something to really think about, right? That it's unfortunate that people, and I'm not sure about this patient, was he in his right mind or not, but we still have to think about this person still said it, right? Like, and how could we not necessarily avoid it, because we can't avoid how people think or what they're going to say when they look at people with a different race or a different skin color and things of that nature. But what are some ways that we could fight racism in the workplace, or like how can we go about it? Not just in case of you personally experiencing racism, but like, let's say you have a coworker who experiences racism. How can you be an ally? How can you like support that person? Because it is something that is hard to discuss, right? Is there any ideas that anyone may have? And you can write it in the chat if you have any. Like, even as a professional, I know that if I ever experience this, I'll have to first go to my director and tell them the incident that occurred. Just let them know that I don't feel comfortable even in treating that patient at that time because of X, Y, and Z. Being a part of a rehab team, there's mostly other therapists that could treat the patient. So even trying to de-escalate the issue, not trying to escalate the problem, the situation, but just trying to figure out a way to make sure that me as a therapist is comfortable still treating patients. It may not necessarily be that patient anymore, but always trying to figure out a way to still make myself feel comfortable still treating. Oh, thank you for that, Zoe.
I'm lashed out,
come up.
and like as he lashed out.
What's that?
Someone
And then
had come up to me, I
lashed
guess, said,
out, and like he lashed
Give
out.
me 1 second.
someone had come up to me.
Okay. So the last video I'm going to show is just being a Black OT, and not just necessarily being just an OT professional or clinician. It's also being a Black OT student. For me, I had a good experience in the OT program. I didn't feel like I was isolated or neglected or any type of way, whereas through research, and even during the research in the OT program, where we had to find different studies and qualitative studies of different OT students who had different experiences where they didn't feel supported or didn't feel supported by their faculty or the students in the program, and they just felt like leaving, or just the rate of the retention for the program was very low in terms of Black students. And it was because of these different factors, not just feeling supported, but also financial things as well. Maybe they may be a first generational student or a grad student, and they're the first person in their family to go to college. They're the first person in their family to ever get a degree. And these are high expectations that they have for themselves, but knowing that their family doesn't understand what they're going through, they kind of feel by themselves. So these are certain things that I have read in different research studies, which we'll talk a little bit in the next couple of slides. but these are kind of like the main things in terms of finances, in terms of support. Those are really big things that will keep the person who is representing racial diversity to stay in a program. If they feel supported by the faculty, if they feel supported by their other peers, and they are not having to worry about finances, that can be a huge reason for them to stay versus leaving and going to pursue another degree or another program. So in this episode, this is actually like one of my favorite episodes because this is Courtney, who actually is another alumni from IC as well. And we were just kind of talking about our experiences being in the same program. We didn't graduate the same year, but we both being people of color in a predominantly white and female profession and program, it was just something that really took me to heart because we can have similar experiences. But this part where she talked about was about finances, and there was somebody that kind of questioned why she got a certain scholarship because this particular person had the same kind of qualifications as her, but the only difference was that she's Black and the person that questioned her was white. So I just gonna let this video go.
Like I said, found out that I had it, and they said to me, you know, I feel like as a Caucasian female, like it puts us at a disadvantage, you know, getting into certain schools and programs, you know, for someone who might put forth the same level of like academic effort and maybe score the same or higher.
Just think about where we came from and the journey that we're still fighting. The Black Lives Matter movement, the injustice that has been put on all of these Black innocent people, that so many Black people have lost their lives for no apparent reason because of just prejudice and ignorant people that think that they're doing something wrong and they're just living their daily life.
So the question I have for people to kind of have just to think about, or if you want to answer, you can answer in the chat, is how can non-Black OT students or OTs and other allied health professionals support students or therapists who represent Black, Indigenous, and people of color? Because when it comes to questions like that, it's kind of hard to I feel like you shouldn't have to explain yourself in terms of why you got a certain scholarship, especially if it's geared towards a certain race or ethnic status or income. You know, there's certain requirements as to why some scholarships are the way they are. And it was such a deep question that even till this day, I still don't know how I would even respond to a question like that if that was somebody asked me that. But overall, financial burden is kind of like the major theme or the biggest theme in terms of these qualitative studies as to why people of color are feeling unsupported in programs. And because of that financial burden, whenever somebody receives a scholarship, like what Courtney received, you know, you take that to heart. You take that as like an honor and a privilege because you didn't have to receive that scholarship and you have an opportunity to now pursue a degree that you felt like you couldn't even afford. So these are certain things that we have to keep in mind. And as Dominica said here, I think it's important for people to practice listening and be open to learning and recognize that there is privilege. And I agree 100%. That we have to have a listening ear, but also kind of like that active listening too. Like we're listening and understanding, and you can also have a conversation that this is not about picking a fight about who's better than the other or who deserves the scholarship more than the other, but it's more about community. It's more about understanding and having that empathy, as Jenna mentioned as well. We really have to put ourselves in that other person's shoes and hopefully understand where they're coming from and be as supportive as possible. So here are a few statistics here about just like in OT in general. There is more than 100,000 staff OTs currently in the United States. And there's only 6.5% of Black or African Americans enrolled in an entry-level OT or OTA school in 2019. And only 5% of OTs that are employed are Black. And that is such a low number, as I bring up this one here, that we already know it's a predominantly white and female profession, but Black and African Americans being the lowest percentage of the profession just kind of tells you that there's work that still needs to be done. So really is a question like, how can we change this? How can we kind of make this balance or let people understand that there needs to be an increase in racial diversity as we are caring for a diverse population? And based on research, they're saying that first off, for AOTA being the, being ATA being who they're kind of like that, the image. They are the image of what OT is. And in order to produce more racial diversity, we kind of have to see it from the top up in terms of leadership. So one study did say that AOTA leadership can analyze through their current marketing materials and create a new marketing plan to initially recruit Black and Hispanic practitioners in leadership roles. And in order to progress in terms of increasing diversity, maybe when we start to have more Black and Hispanic practitioners in leadership roles, that can even spark more ideas and more opportunities for other people of color to be involved in leadership roles as well. Not just in AOTA in a national level, but even we can look at it in a regional level, a local level as well. Also in terms of programs, and thinking about just like any OT program in the United States, just analyzing existing institutionalized practices to identify the strengths and opportunities to create that equitable and inclusive policies and procedures for admission processes. So knowing that there are so many requirements for students to even be eligible to be a part of an OT program, such as observation hours, a certain GRE score, or just even GPA, or standardized testing. These are things that people keep in mind when they are looking at these applications. But also the important part is that statement, right? Them to kind of tell their story as to why they should be picked to be a part of an OT program. And there are some times where people of color are unable to have access to other things that maybe non-Black OT students or future OT students may have in terms of this stuff because of the high school that they went to. They may not have the resources to get GRE or standardized testing or study prep courses to prep them for these standardized testing. So we had to kind of keep in mind of these different factors that could really result in maybe a student not looking like they can fit in the OT program, but they have the skills too because of like the passion that they may have based on like their statement. And then another part that I thought was really interesting was COTAD, which is the Coalition of Occupational Therapy Advocates for Diversity. And I know there's a lot of different colleges that do have chapters within their college. And I thought that was something interesting to bring up because I was actually thinking about creating one when I was at IC, but I didn't get the chance to do it. But I think that's something to keep in mind for the future. If there's any student that listens to this, that they're thinking about creating a chapter at Ithaca College, I think that would be a great opportunity to kind of, not just for the college specifically, but being able to start to branch out and connect with other colleges that may have chapters within the upstate New York community. So I think that would be something that will bring benefit to the program. And then in all, just like mentorship. I think mentorship is huge. I really take that to heart when I find an older OT that is Black, that has been in the profession for over 20 years, and they can really tell me, what to do and what not to do, because they kind of did the trial and error themselves. And it's really different when you are just having a mentor who is in your specialty field, but then somebody that looks like you, because they really understand the situations that you may encounter as a clinician in the future. So overall, these are some final thoughts that representation does matter, not just in students, but faculty and clinicians. If we start to see a more diverse representation of what OT wants to have in 2025, we're about to enter 2023 pretty soon. We need to represent diversity in all costs within all levels. Also promoting diversity within educational programs. So all the OT programs, just promoting diversity within the program itself, whether it's case studies, whether it's guest speakers, or even like things like this that IC is doing right now. Just highlighting the importance of improving diversity and just having that discussion, and not just like an argument, but more of like a very effective and non-judgmental space to have these discussions. Improving additional education and recruitment opportunities during middle and high school years. I think that is huge. As I mentioned before, I did not learn about OT until college, and I felt like that put me in a disservice, because if I knew about the program beforehand, I would have applied to basically all OT schools, but I kind of had to figure it out myself and kind of learn what OT was as I was in the program. And in order to avoid that for future people that may love what OT is, they just don't know what it is or how can they learn about it, is through these recruitment opportunities at a younger age. And then overall, just creating a non-judgmental and safe space and opportunity for discussion, as I mentioned before. So this is the last quote: if you want to go fast, go alone. If you want to go far, go together. This is just a really important quote that I think about all the time. It's because we can go fast, we can get through point A to point B by ourselves, no problem. But if we really want to go farther in this, in terms of increasing diversity, increasing inclusion, to make sure that our profession is really representing diversity, we have to do it together. So it's not people of color on one side and non-minority people on the other. Like it's a community thing, and it's really something that we have to fight in together. And in order to do that, we have to support each other. We have to really show that empathy, and as we come together, we can really go far with this thing. And this is all my contact information. I'm on Instagram for the most part, not really on Facebook, but I'll still answer. I'll find the messages, but I also have my emails here as well, if you ever need any assistance in anything. And that's it.
Wow, Amber, thank you so much for that exceptionally thoughtful presentation. I know I can tell just by the chat that a lot of what you said really resonated with a lot of people. And thank you so much, everyone, for your engagement in the chat, the sharing of resources, and really thinking about the systemic and institutional implications of racism from all contexts, both within OT and without. So thank you so much, Amber. And now is your time. If you have any questions, again, please feel free to put those in the chat. You can private message any of the moderators as well. Unmute yourself. But yeah, this is your time if you have any questions that you would like answered to speak with Amber. Oh, and I just saw in the chat that Mindy said, I am so moved and proud of Amber, but she's on her phone, so wanna bump that.
Thanks, Mindy. I miss everybody. I need to come back to Ithaca real soon.
Yeah.
Hi everyone, it's Sue. I want to thank you so much. I appreciate all of the offerings that you gave us. Lots of things to think about. I wanted to ask a little bit about whether you think there are potential research opportunities to continue the work that you did with Dr. Carol Dennis. I'm wondering if I know you're working in this the geriatric space. I wonder if there might be future research opportunities within that space or with other allied professions as well. Just curious about if you're interested in doing that. I'd be interested in doing that too. Yeah.
Yeah, like I honestly haven't had the chance to dive deeper into like neuro research until like actually like this presentation. But even from when I was a student till now, the research is still saying the same thing in terms of like the themes, in terms of like the lack of support of faculty or the lack of support of students, just everybody experiencing different things that I probably wouldn't have, I didn't personally experience, but obviously like it's still an issue, like it still needs to be heard. And I would love to continue with that research too, because in order to see change, we still have to promote and advocate for it in order to see some change done. So yeah, definitely. And there is research out there for doctors and nurses and all this other allied professionals, but not necessarily occupational therapy practitioners. We kind of see a lot of OT students having these qualitative studies, but not necessarily the feelings of OT practitioners who represent diversity.
Thank you.
I'll jump in with a question. Amber, also echo what everyone's saying. I'm just so proud of you, and it's amazing to see in just a couple of years, and hopefully this inspires our current students who are on the call to see you know, the impact that our students, our alums make on the profession in a short period of time, even just in 2 years, in like really hard times too. Like for, you know, this is all in COVID when you started this like incredible podcast and all the work you're doing. So just, you know, huge kudos, and we're so proud of you. My question is, do you have, like, if you could think back, what advice would you give for your, like, I don't know, 20-year-old self in your junior, senior year, grad year of the program? Like, what would you want to tell student Amber now, if anything? Because I'm thinking maybe that would help some of our current students.
I mean, yeah, I would definitely tell my younger self, especially during like that senior year hard, like those hard adult blocks and pediatric blocks, that that it's okay that you don't know all the answers, because especially like in school, you want to get these good grades, you want to get A's and everything, and you want to do all your practicals and all these other things. Like I remember even thinking in the top of my head when I had a kidneys practical and I literally froze and I was crying because I was just like, oh my goodness, why can I not remember this simple thing? And I really would tell my younger self that it's okay to not know everything, because as a clinician, I still don't know everything. I still have to look up things. I look at my books, or I do a quick research thing online in order to provide the right information. We're not going to know everything on the top of our heads. And unfortunately, I feel like that's what the NBCOT wants you to kind of think. And that's kind of like how my journey was when studying, that I had to know everything. And yeah, you don't. It's okay to not know.
Hi, Amber. I just wanted to say thank you for this presentation. I thought it's very important topic to discuss. I just finished my second level 2 at a hospital, but my CI was also well, she is Asian American, and I had a whole entire conversation with her and had mentorship from her about what it's like to deal with racism in the workplace, because it was something that I did experience, and was something that I got to have conversations with my CI, and how important it is to have a mentor who understands what you're going through. So I just wanted to thank you for having this presentation about this topic and everything. And then also, I'm on day 2 right now of my specialty, but I'm coming close to studying for the MBCOT. So what's your biggest advice for that, for the first step of getting through that battle?
First of all, I'm glad that you're CI and you had that connection, because that's huge. And I'm sure you guys are still going to keep in contact even post field work as well. And then in terms of the MBCOT, it's so funny. If you want to kind of get more information with that, I will definitely suggest you listen to the podcast, because I went in the beginning, I don't know how many episodes I talked about the MBCOT, like at least like 15 episodes. So short answer, definitely give yourself grace. Don't take like 5 hours to study. Your brain is just gonna hurt. It's just not the most effective way to study. And I would say continue to participate in those meaningful occupations while you are studying. In my first couple of attempts, I actually stopped working out. I wasn't going to the gym. I was just studying, or I felt guilty that I was at the gym and not studying. And then during the time when I was prepping for the boards, my 4th time, I brought back my fitness and going back to the gym, going very consistently, not studying as much, and I felt more relieved. So I would just say continue to do those things that keeps you calm, that keeps you motivated, or just kind of like not let you think about studying while you're doing this activity. It's going to be hard, but just try your best, but don't get stuck on studying all the time. It's going to be it's not going to help.
Okay, thank you so much. And I'm definitely going to look at that podcast.
I have a question. I haven't gotten any field work yet, but it's coming up in October, my level 1. And I've just been kind of thinking about like where I'd want to work as an OT and like what spaces would be safe for me and comfortable. So do you have any like experiences where like you've been surrounded by supportive like staff and other professionals, or like any settings where it's like more comfortable or just easier with your skin color?
Yeah, so I wouldn't say easier, but as you said, like supported. Right now, I do enjoy the facility that I'm in. We do have a pretty diverse group of therapists. So we have Black therapists, we have Filipino, we have Indian. We have like a nice mixture. So it's kind of nice to really work with each other for the most part. And then I actually connect a lot with the CNAs, and majority of CNAs are in my facility are Black or of West Indian culture. And I tend to really relate with them a lot, or talk to them and just let them know like, hey, if you need help, I got you, don't worry. And they're just very supportive. Certified nursing assistant, sorry. But yeah, they're very helpful for them. Like so far, the CNAs that I work with at this facility, they're great. And I get to talk to them. We can joke around a little bit. And it's not a judgmental environment. And I feel like as you come in as your authentic self, you can literally work with everyone. I don't know you personally, but I'm sure you're an amazing person with a great personality. Like you are in the OT program. So I know you already have the skills to be a phenomenal therapist, and just be your authentic self. Like if you like to have fun, you like to joke around, like of course, like in a professional way, but like, you want to have fun in your job and you want to learn. And level 1s is really like not as extreme as level 2s, where you are going to uphold a whole caseload on your own by the end of the field work. But just take the time to really talk to the patients, hear their story, and just show that you have that active listening ear. And to get that therapeutic use of self is like really key for level 1. So as long as you just be yourself, everybody's gonna love you.
Thank you. And I also really appreciate your presence here and your presentation. I also listened to your newest podcast and loved it. And I will be a follower / a subscriber. So thanks.
Awesome. And if you have any questions as well, like feel free to hit me up, okay?
And we are unfortunately just coming up on that time. I feel terrible cutting this off, but thank you all so much for coming. Thank you, Amber, for sharing your story. And one thing that really shone through to me throughout the whole thing was the importance of community and finding your community. And I'm so grateful that we were able to get this community back together tonight and to begin the next series of this. And again, truly could not imagine a better way to have started it than with you, Amber. So thank you all so much for being here. Our next session is going to be on October 26th with Danica Viola on occupational therapy and women's health. So we'll be sending out many reminders before then. But thank you all again so much. And as a reminder, this recording will be posted. And Amber again shared her contact information. So if you need any way to get in contact, please reach out to any of us and we will be happy to connect that. So thank you all so much. Have a great rest of your night and be well. Thank you.
Thank
Are you okay with
Good night.
posting